A very good evening, everyone. Am I audible and visible at all the places? Please confirm. Hi, everyone. This is Dr. Sandeep Sharma here. Some of you already know me. Some of us, we may be not meeting that often. So I welcome you all to this another live session. This is a series of sessions we have planned at Prepladder Super Speciality Dream Team Pack, where we'll be guiding you, we'll be advising you on your approach for your entrance exam, and I will be taking up the doubts as well. So hi everyone. Good evening, Raghavendra. I hope you're doing good, Raghavendra. Uh, Hi, Janani. Good evening. Hi, everyone. So I'm just waiting for more people to join in so we can start. So for those, good evening, Madhu. So this session, it's going to be a short, crisp session. What I'm going to do is, initially, I will be taking up some of the doubts. I have two very important announcements to make, which is going to bring a bit of smile on some of the people's faces. I'll also, in the end, so stay tuned. In the end, I will be talking about effective revision strategies for your super specialty exam in the last 1 month. And as a lot of students requested, sir, the bare minimum topics which must not be missed out. I will be talking about, I'll be enumerating those topics as well. You may or may not get questions from that, but if you're preparing for NEET SS, you must have a look at them at least in the last week or 10 days before the exam. So, all that list, brief summary of that list, I'll be talking about in the end. So, I'm just waiting for most people to join in. So it's a good number of people who have joined in here. So good evening, everyone. So let us start with the session first of all. So the first important thing that I want to, I have my laptop also here. So I'll be looking at the chats simultaneously and answering the chat simultaneously. I just want this session to be a interactive session. That's what my aim is. All those who have joined in, please like and subscribe the channel because we'll be coming out with more updates, academic updates, crisp one-liners in the next 1 month or so. So you do not miss out on anything important. And all these live sessions, their notifications, some of them will be last minute planned. So you will be getting notifications. If you have liked, if you have subscribed already, you will be getting notification for that. So just like and subscribe the YouTube channel that we are live here. So the first announcement from my end. As promised, last session which I had taken 2 weeks back, many of you had requested, sir, no grand test has been done so far. Please organize some grand test. So at Prepladder, we are going to have two mock tests, full-length mock test. One will be held on 7th of August, and from 7th to 11th, the test will be live for 5 days. The second mock test will be done 2 weeks later. It will go live on 21st August and it will be live till 25th August. Both the tests will be separate tests. Each test will be 150 questions to be solved in 150 minutes. So you can have a real life feel of NEET super specialty exam before you sit in the actual exam. Secondly, it will help you in time management. Thirdly, whether you are a subscriber of Prepladder Super Speciality or you are not a subscriber of Prepladder Super Speciality, you can sit in the exam for free. Yes, you can sit in exam for free. I always say, uh, अगर फ्री में जहर मिले उसको भी रख लेना चाहिए. You should not drink it, but at least you should keep it for yourself. You never know where it may come through, where it may come handy. When it comes to mock exams, they are very important, particularly just before the entrance exam. You know that there is a paucity of material, paucity of MCQ related resources available for super specialty exam, and so there will be dedicated mock test. I repeat, one mock test will go live on 7th August. Second mock test will go live on 21st August. Two separate mock tests with detailed answer and explanation following that will be given. Ranking will be given, and you need to register for those. You can register for free. The link will be available in the comment section. So comment section, it will be pinned shortly. You can click on it and you can appear for the exam. So whatever doubts you have, you're most welcome to ask it. Where to find the treasure video explanation in Prepladder app? I'll ask the Prepladder team which is sitting alongside to help you regarding that, or we can summarize it in the I'll summarize it in the Telegram section as well. It is difficult to do it in a live session. Good evening, Dr. Shreshi. Janani is asking, sir, I find oncology a bit difficult and treatment, all phases and drugs find it tough to remember. Janani, go stepwise. Not everything in oncology is important. The solid tumors like neuroblastoma, Wilms tumor, and brain tumor, you have to do inside out everything is important, including the drugs and their dosages. ALL and AML, the frequently used regimes you need to remember. Even if you don't remember the dosages of substance of anti-chemotherapeutic agents which are used in ALL and AML, it is absolutely fine. For other tumors, only the names of commonly used drugs are good enough. You don't need to go into too many details. Whenever you are reading a particular thing, Wilms tumor, neuroblastoma, brain tumors, you have to read everything. ALL, you have to read everything except for the doses. AML and other malignancies, go selectively, focus only on the key important aspects and not the fine drug dosages. Harishankar is asking, is separate pediatric mock test? Harishankar, yes, I said separate pediatric mock test will be available. First will be live from 7th and second will be live from 21st. Dr. Shreyasi is asking, would you please be able to discuss red flag signs of development milestone? Sure, Shreyasi. I'll just write it down. I am planning to take 10-minute small sessions over the next couple of weeks before your super specialty exam. And red flag sign, I'll definitely take up. I'm just writing it down in front of you. Red flag sign, we can consider as a small 5-minute discussion on that. I'll take it as a live session, not on the app. Arshdeep is asking, sir, what is the most common cause of intestinal obstruction in newborns, jejunal or duodenal atresia? Arshdeep, it is duodenal atresia which is more common. Arshdeep, what is most common cause of inherited hemolytic anemia, hereditary spherocytosis or elliptocytosis? Again, it's controversial, but hereditary, if they say most common, दोनों में ज्यादा common क्या है? Then slightly more common is elliptocytosis. But if the question says hemolytic anemia, clinical anemia is produced more commonly by hereditary spherocytosis. How to remember so many chromosome number and genes? Faraz, you have asked a very valid question. You cannot remember every chromosome number and gene. How to go about these genetic syndromes and how you are going to remember the names. Some suggestions about it I will be discussing in the end today. I will be taking it up today. Some neurology important topics. Again, I'll be discussing in the end of this session today. And just waiting for your doubts, whatever doubts you have, which the list I'm not going to elaborate in the beginning. I want more people to join in, and then I can, that will be the last finale of this live session that we are having. Arpit is asking, I find endocrine difficult, like hypoparathyroidism, pseudo hypoparathyroidism. We don't have video on DM also. Please suggest Dr. Arpit and Dr. MD. Diabetes mellitus this month itself, before you sit for your exam, it's my guarantee you will get diabetes mellitus videos, the selected important things from diabetes mellitus on the Prepladder app itself. I am recording right now. Right now, I'm sitting in the studio. I had meeting with the management. Some of your grievances were conveyed to them. Missing video thing. I sat and looked at the list that has also been rectified. A lot of things you had asked for. Again, another second important announcement I have to make. A lot of you had asked for videos on topics which are difficult and are not there, or you do not find adequate on the Prepladder app. Renal tubular acidosis in details I have discussed. It is already done. It is in post-production. Individual Bartter and Gitelman syndrome details have been discussed. It is in post-production. It should be available very soon. Uh, infant of diabetic mother, management of CKD, obstructive uropathies, the approach to neuroregression, all of these things have been recorded in the last 2 days and they are all in post-production. So maybe 2 or 3 days, maybe by this weekend or maximum by Monday, you will have them. I've tried to keep them to the bare minimum so that you can do multiple revisions rather than going into unnecessary pathophysiology. I've taken a retrospective approach. I've talked about features and then I have talked about what is the normal physiology and what exactly happens in them. So that will be beneficial for you. Please take a class on GINA 22 updates. Yes, GINA 22, I do have to take. I do understand. And this is second thing I will take up as a live update, either live or recorded, but that will be there for sure around 15th of August. Around 15th of August, by 15th, between today and 15th of August, we'll have at least 2 recorded sessions of key last minute revision things which have not been covered or briefly touched in the app section. Discussion of that, exam oriented discussion of that, I will be putting up shortly. Uh, Arshdeep is asking what is the most common intestinal tumor, lymphoma or colorectal cancer or hematomas? Arshdeep, remember that hematomas are benign tumors and they will always be more common. When it comes to lymphoma versus colorectal cancer, in case of children, the lymphomas are always more common compared to colorectal adenocarcinomas. Colorectal or adenocarcinomas, and they usually occur in children as a part of a syndrome. Isolated sporadic colorectal cancers are a relatively rare finding in children. Arpit Sohane, do you have to do MCQ from other places also apart from the ones in app? Arpit, MCQ practice can be done anywhere. It's like you asking me, sir, I want to play in IPL. Should I do practice only in the net, or I can do practice at my home also? If you can find the resources, practice is what is important. Make sure that the solutions are correct. In case you find that there is any inaccuracy in the source which you are using, you're most welcome to ask about the pediatric questions to me. Today itself, getting up at 7:30 in the morning, I sat on my Telegram and I answered almost 50 to 60 queries which had accumulated in the last 4 or 5 days. Most of the academic queries I've already resolved on my Telegram page. So in case you find any, just do ask me. Uh, Important topics in cardiology. Yes, important topics. I'll be talking about it. See, cardiology is very difficult to predict, but in general, in cardiology, there are topics like TGA, topics like TAPVC, Epstein's anomaly, hypoplastic left heart syndrome, tetralogy of Fallot, and surgery timings related to various conditions. These are the things you should be focusing upon. Tuberculosis National Program 2022 update. Manin, I've already uploaded IAP and TEP 2022 guideline summary. It is there on the app. If it is not available, please let me know. I had recorded it almost 2 months back. Congenital syphilis I've already discussed before. There is a uh, live video I had taken about 2 months back in the month of June, where I had discussed important congenital infections. You can do a Google search. It is there on the Prepladder YouTube channel. You can have a look at it. More details if you want. You're most welcome to ask me about it. Uh, HIV class, sir, please, so much needed. Arshdeep, HIV part 1, HIV part 2. Two separate videos, each video about 40 minutes of length. They are being recorded right now. Like I'm in the session today and tomorrow. I'll be there in the studio and I'll be recording. HIV 1 and 2 is a part of my so-called statement of work which is to be completed. So that will be done by this weekend. So most likely by Tuesday or Wednesday, it will be available to you. So if you haven't read HIV in children so far, don't worry. At least the summary, two-part summary, which will be coming to you, it will be available by Wednesday. You'll be able to read it. Janani is asking, sir, baby born to HIV mother, after how many weeks do we do DBS? Again, HIV in mother, HIV in baby, infant feeding guidelines. It's a flowchart based approach. Have a look at the video in case you have any doubts. You're most welcome to ask again. I'll be coming live again. I'll try to come live every weekly now. Sagar Reddy is asking, sir, most important cause of sudden death. Alka from right sinus of Belsarva or valvular aortic stenosis. Aortic stenosis traditionally, almost all standard textbooks say aortic stenosis is the overall most common across all ages. This is what is mentioned in most of the texts, adult as well as pediatric, which I could come across. What is the division for general and systemic questions for NEET? The division between general and systemic questions they have not mentioned, and so it is going to be as much of a surprise for you as it is to be for me or for anybody else. Just go into the exam assuming that there will be almost equal distribution. There will be about if there are 150 questions, you can expect about 15 to 20 questions from general pediatrics, about 5 questions related to biostatistics and health programs and vaccines. You can find about 5 to 10 to 15 questions from neonatology, similar number from gastro plus hepato, similar number from neurology, similar from rheumatology and immunodeficiency disorders, similar number from infections, then from neurology, musculoskeletal rheumatic system. So if you calculate them, most of them come in the range of about 130, 135 questions. Remaining 10 to 15 questions, they are those questions which you can't really put in one place. They are based more upon critical care, PALS guidelines, recent updates, some new drug, some therapeutic profile, some antibody which has been recently approved. So those miscellaneous things will be about 10 to 15. This is what we are assuming. We do not know If you go and sit in the exam and you find that there are 40 questions from general pediatrics, it will be a surprise for you, it will be a surprise for me, it will be for anybody. The point is to be flexible and go with the open-minded approach. If it is difficult or atypical, it is going to be atypical for everyone. And that is why over the next 1 month, it should be a balanced approach. ऐसा नहीं कि you are spending 20 days on neonatology thinking कि neonatology से ज़्यादा आएगा तो I will score more. Have a balanced approach. Touch every system and at least the important things in every system. That should be your revision approach. So go with the open mind. Um, Arpit is asking cause of reticulocytopenia thalassemia major while other hemolytic anemias there is reticulocytosis. Arpit, it is related to ineffective erythropoiesis. The concept is related to that is ineffective erythropoiesis plus the type of thalassemia which is involved. Again, I'll have to go into the details and tell about it. Thalassemia again, I have to record and thalassemia will be put up. The earlier there was a video on thalassemia already recorded by the medicine faculty and the same video was there in the pediatric part also. But later on, I think because it was removed from the pediatric part once the regrouping of the app was done. So I'll try that at least till that time that thalassemia video is available to you. And in case you can't find the reason or if it I have not seen that video, so I can't say whether it has been explained in that or not. I'll put up a thalassemia key reasons video as a recorded video very shortly. Right? I'm noting down the things which I'm mentioning. Red flag sign, GINA 2020 to 21-22 guidelines, and thalassemia key points because I haven't put a detailed video on that. I'll take a small summary video on that shortly. Arshdeep, sickle cell anemia, I've already recorded full details. It is already there. Rudresh is saying stop asking most common, least common, new videos topic to be covered. Help. Rudresh is saying fine, but okay, it's an open platform. You can always ask. And let me clarify one thing also here. See, end of the day, I know my subject, but there will be facts which you will be asking, sir, which is more common among these three, or what is the percentage of that particular disease? Uh, if there will be such questions where I will not know the answer, these are all fact-based things. For a fact-based thing, you have to refer to the resources. So whatever I don't know, I will tell you. I will have a look and I will let you know. Ishwarya Chandra, sir, important topics from IEM. From inborn errors of metabolism, first is the general approach part, which is given in AIMS NICU protocol that is to be done, right? Secondly, you should be focusing on glycogen storage disorders. Glycogen storage disorder, almost sure you can be that at least one or two questions will be asked. Focus on which is having cirrhosis, which is having effect of glucagon and epinephrine injection. Then you should be focusing on the deficient enzyme, the which of them is having muscle involved, skeletal muscle involvement, which is having cardiac muscle involvement, and so on. These are the typical things in glycogen storage disease you should focus upon. Third thing, you should focus on the classification of mucopolysaccharidosis and corneal clouding is present in which one, corneal clouding is absent in which one, and dysostosis multiplex is a feature of which of the following MPS and it is not present in which of the following. So those kind of clinical diagnostic conditions you should be focusing upon in inborn errors of metabolism. Ishwarya Chandra is asking why is neurology question bank limited? Ishwarya, I'm not competent enough to answer that. I have not made the question bank, but the point here is earlier neurology was a part in the older system. Neurology was a part in adult uh, super specialty part. Like pediatric neurology was and adult neurology were clubbed together in the previous system of examination of NEET super specialty. So the question bank was made accordingly. Later on, what now pediatric neurology is going to come as a part of the NEET SS pediatric part. And so the pediatric questions, when they were sorted out, I think the number was relatively less, and so you have lesser number of questions in that. It has been flagged by me already, but that is all I can do at my end. Thalassemia, sickle cell anemia mutations are little confusion. Please explain. Arshdeep, yes, I will explain. I'll try to explain the mutation part. Sickle cell anemia I've already taken up. I'll repeat. Individual vaccines class, sir. Nandakumar, yes, I will do that. Please keep liking and subscribing those who haven't done so far so that you don't miss out on any update, right? And Dr. Shresi is asking, sir, could you please enumerate the novel therapies or monoclonal antibodies for last minute revision? Yes, monoclonal antibody. I like teaching monoclonal antibodies. So I'll take a small session on that. Nomenclature, how we classify them, what is zoo, what is out, all the basics I will be taking up. And the important pediatric monoclonal antibodies, I will take it up as a recorded session. Then important poisoning videos, Dr. DB. Not all poisonings are important, but at least paracetamol poisoning. And there, for a quick revision, I told in the last session also, you can have a look at the chapter given in OP Ghai or the chapter given in Piyush Gupta, the Indian textbook. You can have a look at that. Kindly do videos on DSD from Nelson. DSD, yes, it is a tricky thing. That is there on my agenda. But you need to understand the exams are too close. We can't do so many things together at the last minute. We need to spread them out. I'll try to do as many things as possible. And I'll be visible to you, available to you before the exams on almost alternative basis, not as a live session, but on social media. Is hydrocortisone contraindicated in neonates? My senior said no. No, it is not contraindicated. Who told you that? Hydrocortisone is not contraindicated. There is no such thing. Rudresh is asking individuals some important vaccines like pneumococcal, DPT, MR, influenza, etc. Yes, Rudresh, these things are important. Like, for example, they may ask you which type of pneumococcal vaccine is a part of national immunization schedule, and you know that the answer will be you have PCV7, which is no longer available, PCV10 and PCV13. It is PCV13, which is a type. What is the difference between PCV10 and 13? What are the three strains which are not covered? This is something important. Then PCV13, what is the schedule in IAP? What is the schedule in NIS? Those are very different schedules. Number of doses are different that you need to remember. Similarly, MR is a part of National Immunization Schedule. MMR is a part of IAP schedule. What are the differences? What is the minimum age you should be giving? And what are the contraindications? I'll try to summarize all of them if possible. So yes, vaccines is something that needs a summary. I'll not be putting separate discrete videos on this. The same video will have 3 or 4 topics being covered in 10-minute, 10-minute, 10-minute kind of each. Okay, most common cause of juvenile onset. Okay, most common cause of neonatal meningitis. Thank you, Prerna. I am trying to be consistent so that everybody is consistent in revision and you all people just clear the exams and go on doing your specialty of choice, right? Consistency is important. I have not been consistent in certain things and I have always suffered because of that. Consistency is always more important than I would say even the hard work that you are putting in. If you are consistent in whatever you're doing, you will eventually get through. Uh, यार मोस्ट कॉमन कॉजेज ना मैं बाद में अलग से करूंगा फ्रैंकली मेरा आई एम नॉट द काइंड ऑफ पर्सन की देखा और याद हो गया if you explain a concept to me, I will remember lifelong. But if you tell me 10 different facts, I will remember only 5 facts after some time. That is the kind of person I am. So these most common, least common, suddenly blackout मुझे भी होता है. It is a live session. So in somebody is asking neonatal meningitis. See, neonatal meningitis very simple. World के अंदर it is group B streptococcus followed by E. coli. India के अंदर it is Klebsiella followed by E. coli. Listeria is among top 3 to 4 causes in world as well as in India. Please remember that. And if the question says neonatal meningitis between 7 to 28 days, yani ki late neonatal period, the answer will always be E. coli. There is one journal and one old Indian textbook also which say that in almost all cases of post 1 week of life in the neonatal meningitis, E. coli is always the commonest organism in India, right? So this is the information I've given you. World, group B streptococcus E. coli, India, Klebsiella E. coli, Listeria among top 3 causes in world as well as in India. Protozoal helminthic infection, Arpit, I have not discussed them. Frankly, very little questions are asked from them in need to super speciality. Is bar aa jaye to I cannot predict. See, something happens, I cannot predict that. But usually nahi aata hai, and that is why we do not cover. It is there in Nelson. If time permits, you can have a look at them. At least neurocysticercosis is very important. NCC ka, please note down. There is a Association of Child Neurology update on neurocysticercosis. Very, very important. वेरी इंपॉर्टेंट, प्लीज राइट इट डाउन दैट जाने से पहले एटलीस्ट उसको पढ़ के जाएंगे बिकॉज इट्स अ वेरी डिटेल्ड समरी एंड इट इज ओरिएंटेड टुवर्ड्स इंडियन चिल्ड्रन. It there are differences in it compared to the Western data and Nelson what says. So please remember to go through it. I don't think other things are other helminthic infections. Even if I have 1 year to prepare, I will be reading them. Hmm. Good. Where can we find past NEET SS papers? Kriti is asking. Kriti, इसका आंसर मेरे पास भी नहीं है. टू टेल यू फ्रैंकली, ओके, टू टेल यू फ्रैंकली, आई एम trying to compile and write a book on the past super specialty papers, but it is a thing currently in process. It will take a few months to come out into the market. So if you're targeting this NEET super specialty exam, I don't think I have much resources to offer. You can go to Amazon, you can try to Google NEET super specialty pediatrics. There is one book from one author which is the only book available in the market. You can see if you have some friend who has that book, you can see. It has a collection of papers. It is majorly neonatal based. The problem is the questions do not have explanation in them. The answers are fairly fine, but the explanation is not there. And some of the questions are not exactly the way they have been asked in the exam. So there are two papers I can, if I correctly recall, they are there in the market, 18 and I think 19 paper. So you can have a look at those papers. Other than that, there is a positive material, unfortunately. Recall video, YouTube, I have already recorded 3 to 4 months back. Prepladder channel, you can have a search and you can have a look at the NEET previous 2021 paper. Uh, Ashutosh Sharma is asking neonatal myasthenic syndrome. Ashutosh, I haven't discussed it because I haven't gone into myasthenic part. So that will be done. Obviously, I have to replace some of the existing videos, but I will be doing it after the NEET SS exam, not in this NEET, in the next 1 month. No. Uh, Nishant is asking how much repeats can be expected. Meenakshi Bothra book helpful or not? Nishant, repeats can be expected, not direct repeat, but topic repeats. So any topic which has been asked in the last 2 or 3 NEET super specialty paper, you have to read it at least the bare minimum points from that. You cannot skip that topic. So indirect repeats are expected, and on an average, you find that every NEET super specialty paper, about 10 to 15% topic repeats do happen. They do happen. Regarding the book by Dr. Meenakshi Bothra, that is a good book, but that is majorly oriented towards your NEET PG exam, and it has also questions from FMGE. Obviously, FMGE, MCI screening questions are not going to be asked in NEET super specialty, but only for practice purpose, if you want to do, it is a good book. But only for practice. Do not expect those things to be asked in super specialty exam. Graphs of capnography, ventilator graphs, PFTs. Dr. Shreyasi, these graphs, ventilator graphs, PFTs, they are number one time consuming and they will require lengthy videos. And even if I put them up by 15th, 16th of August, you'll hardly have 10 to 15 days going through them. They are usually traditionally more important for the INI super specialty exam. And trust me, as soon as I get time, I will put up updates on these. I have already promised before also related to capnography and these things, the bare minimum things, what exam oriented things, not the basics, exam oriented things. I will try to put it up, but I can't promise that. Uh, Dr. MD, I've just told you about it. Uh, More things. Can't solve EEG and ECG questions when sitting for an exam. Arpit, EEG, even I have problems understanding. EEG is a very specialized thing. If you give me 10 ECGs, maybe I will be able to correctly answer 7 or 8 out of them. That is what I feel. But if you give me 10 EEGs, maybe I would only be able to identify the common patterns like hips arrhythmia, spike and slow wave pattern, or the typical, P-led pattern. The usual EEGs are difficult. Please remember, if you get a ECG or EEG question in the exam, it will not be isolated key, look at this and tell the diagnosis. There will be a clinical spectrum, there will be a clinical description, there will be age mentioned, and then based upon that, the ECG or EEG will give you a clue. So if you do it in a holistic form, if the question is saying that there is a girl who's having brief vacant steering look, and then you have a EEG showing 3 hertz spike and dome pattern, then you can easily say it is absence seizure. If they give a random EEG, it will be a kind of unsolvable question at your pre-PG level. Nobody gets a 100% score in the exam. So those kind of unsolvable questions, I think 1 month before the exam, you shouldn't be bothered too much about it. Focus more on the doable part, the revision part. Yashwant, I'm interested in, should I do DM or fellowship is enough for practice? Yashwant, it depends upon what you are getting. See, if there is DM available, if there is fellowship available, DM is always superior. DM always carries more weight. DM always gives you better employment opportunities and better starting packages in metro hospitals. Having said that, if you are unable to get DM at a good place, even if you get fellowship and you do want to be a neonatologist, fellowship also is going to be very good. The point is, it is an individual decision you have to take whether you want to drop and take going for DM or you want to do it for fellowship. See, point being very clear, there are many in at least in the bigger cities like Delhi, Mumbai, Bangalore, Kolkata, Hyderabad, even Chandigarh for that matter, you will find there are a lot of people who are DM neonatology. So if you are doing fellowship in neonatology, you will be competing against a DM neonatology person, and some degree of comparison will be there. But in case you are going to a smaller town, say you are going to settle in Kanpur, or you're going to do practice in Jodhpur, or you're going to like tier two towns, not the state capitals, then you have a better chance if you have a fellowship. So it is an individual decision that you need to take. Dr. Kriti is asking, with a month left, sir, how much percentage of time should be given to MCQs and how much to just our theory? Dr. Kriti, it should be about 60 to 70% time for theory, 30 to 30% time for your MCQs. That's my take. ECG and eco videos. Dr. Volta eco, I'm not going to teach. Sorry. Eco नहीं पूछा जाता exam में. Who is going to ask eco in your exam? Even if eco question comes, nobody is going to be able to solve it. Trust me. NEET SS में आज तक नहीं आया है. You don't prepare for rare things. You prepare for common things in the exam. Pediatric ECG, Surajit Bhattacharya, ECG class, teaching the basics of ECG is a resident-based thing. It is something which is not oriented towards super specialty exam. So ECG patterns can be taught, but how to take a look at a ECG, what is QRS axis, how you calculate QRS axis, I think that's a practical part. That is something we are not going to take up in the app part. Any advice on number of questions to be answered out of 150? Better solve all or only the ones we are sure? Rutuja, it depends upon the paper. In case you find there are too many repeats, go in for solving almost 140 plus. But in case you find there are too many atypical things, you can take a calculated risk of leaving them. See, if it is a fact-based thing and you have never heard about it, suppose they ask you, new anti-hepatitis C virus drug, what is the drug dosage? Now you have not even read about the name of the drug and they are asking about drug dosage. So the chances of you getting a correct answer is only 25%. So better to leave this question. But on the other hand, if there is a clinical question and you can rule out one of the option कि ये answer नहीं है, calculated risk has to be taken in that question, right? If you are stuck in two option, then you have to take the risk in that question. I think if you go by the general rule of competitive exams, even if it is a difficult paper, still there will be somebody scoring very high in the paper. So your attempt should definitely not be below 120 out of 150. It should not be, irrespective of kitna tough paper hai. Yeah, if I have to give a generalized thing, you need to adapt in the paper between 130 to 145 should be your target, depending upon the difficulty of the paper. Arpit is asking side effects of drugs asked commonly. Which drugs are a must do? Arpit, I'm going to talk about it. Drugs which are asked in neonatology, which includes caffeine citrate, drugs which are used in the antenatal management like antenatal dexamethasone, drugs which are used postnatally like for hypoglycemia and CAH like hydrocortisone, their side effects and doses are very important. Secondly, anti-epileptic drugs you need to do in details. Third, anti-arrhythmic drugs you need to do in detail. Fourth, endocrine related drugs you need to do in detail. So these are the four category of drugs that you need to do in details. You're most welcome, RRNS. Um, I have to keep repeating, please like, subscribe if you haven't done before. And we are coming to, it's almost 40 minutes into the live session. Yashwant is asking, I have raised a concern regarding that, but still I didn't get any reply. Or all the mistakes been rectified in question bank? Yashwant, I think mistakes are being rectified as they have been told. Frankly, I am not a part of that entire system of rectifying the mistakes. Uh, so in case you do find, do flag the mistakes in case they are there. Other than that, at my end, what I can do is you can message or you can mail those queries to me and I can reply with the best possible answer among the options. Now, whether they have been rectified or not, that status I cannot comment upon. Anirudh, what is the scope of pediatric neuro fellowship in terms of job opportunity compared to MD pediatrics? See, Anirudh, in case you are applying to a specialty department, any fellow will always be preferred over a simple MD. That is a general rule. But in case there is a DM person applying, then obviously the DM person will be favored, especially in corporate hospitals or in bigger towns. When it comes to employment opportunities, you need to understand that as a branch, pediatric neurology and pediatric oncology, both of them are institutional branches. The scope of private practice is very limited, and even in top tier towns, you have limited employment opportunities. So you have to be ready to be flexible and move into the suburbs of metros in case you want to, start your practice. Having said that, any specialty, obviously, you will be a specialist. I'm not discouraging you. All I'm saying is based upon my market experience and based upon what I see. These are not MD pediatrics. You can do private practice from tomorrow itself. Pediatric neurology, pediatric oncology, pediatric rheumatology, you can do general pediatric practice, but if you want to see only these specific patients, you have to work in an institution or you need to have a very good referral system, which takes many months, years, I would say, to develop. And Anirudh is asking, Arpit is asking iron deficiency. Yes, Arpit, iron deficiency, microcytic hypochromic anemia approach. Four subvarieties of that. Key points about each is a video I'm supposed to record in the coming week itself. It's a part of my written like agreement with Prepladder. I am supposed to record that. Uh, okay, I've answered most of your queries now. So we are reaching the end of the session. Let me share some of the information. I have already told about two mock tests, grand tests, which are going to be done. Register for free, give the exam. Second thing, I've told you about the videos which have been uploaded and which are being recorded. Thirdly, people asked me for tips for revision, sir, in the last 1 week. Now, this is something important. Suppose you have last 1 month to prepare and you have limited time available at your end. So whenever it is a genetic syndrome that you are going to do, suppose you have to revise a genetic syndrome, you can't read through and through. You should first look at what are the alternative names or synonyms of that. First, you will remember that. Second, you will look at the gene involved in producing that syndrome. Third, you will look at the chromosome involved in that. Chromosome, when you remember, always look at short arm or long arm. Do not try to remember the genetic locus of that. Genetic loci are asked very rarely, except for things like Dye-George syndrome, क्योंकि उसमें माइक्रो डिलीशन हो रहा है 22q11.2 के ऊपर. So वो तो ऐसे याद हो जाएगा. But for most of the genetic syndrome, the fine genetic locus is not mandatory. All you need to do is simply remember cystic fibrosis है, CFTR gene है, सिस्टिक फाइब्रोसिस ट्रांसमेम्ब्रेन रेगुलेटर प्रोटीन को कोड करता है. ये एक तरह का एनायन चैनल है या कि क्लोराइड चैनल है. एंड द जीन इज प्रेजेंट ऑन क्रोमोसोम 7 क्यू, लॉन्ग आर्म ऑफ क्रोमोसोम 7. बस that is all you need to remember. Then in one line you need to remember the function of the protein if it is present, right, and hallmark finding of that particular thing, cause of death in that particular thing, most common congenital heart disease if it is there in that particular syndrome, any named sign. For example, if it is Ehlers-Danlos syndrome, butterfly vertebra is the thing you need to remember. If you in NEET SS there was a question where they had given a case and butterfly vertebra was mentioned. So named signs are important. And finally, whether it is a pre-malignant condition or not. If it is pre-malignant, what is the most common malignancy? So ये 7 या 8 point है which you need to remember for most of the genetic syndromes. Syndromes like Down, Patau, Edward, Turner, Klinefelter, Noonan, Williams, you have to read in detail. Marfan, Ehlers-Danlos, you have to read in details. But for the other majority, 80% जो नहीं पढ़ते हैं हम लोग या छोड़ देते हैं, if you have to revise those syndromes, keep only 7 to 8 points in mind. Alternative name, gene, chromosome number, P and Q, type of protein produced, hallmark, congenital heart disease, pre-malignant or not, what any named sign in that, and you are done. You are safe. If a case comes or if an image comes, it will be very characteristic in the exam. That is one tip. Second tip is when you are asked about the drug dosages, I have already told you neonatology, antiarrhythmic agents, endocrine disorders, you should be focusing on the commonly used drugs. Thirdly, somebody asked me about the past exam questions. Past exam questions, limited information is available. Topics are more important than the actual MCQ which has been asked. Fourthly, vitamin and mineral deficiencies, we have a tendency to, neglect. Compared to malnutrition, protein and this vitamin and mineral deficiencies are more frequently asked in NEET super specialty, going by the pattern of the last three papers. डबल वेटेज होता है एंड वी वेस्ट अ लॉट ऑफ टाइम इन जनरल पीडियाट्रिक्स डेफिनेशंस ऐसा नहीं कि वो पढ़ना नहीं है यू हैव टू रीड प्रोटीन एनर्जी malnutrition also there is I don't know what rule is it but the day you decide कि ये topic important नहीं है you leave it that topic questions double the questions will be asked from that topic I don't know whether it has happened to you or not it will happen to you in the exam so read everything but do not neglect vitamin and mineral deficiencies acrodermatitis enteropathica read in full details vitamin B complex related disorders read in details pyridoxine why it causes seizures what is the enzyme which is involved in that which causes neonatal seizures read in details things like these you need to be very precise when you revise in the next few years next few weeks and then about age wise causes of intestinal obstruction and its DD you will find at least 4 to 5 questions in the exam based upon last year pattern so age wise causes हर ऑब्स्ट्रक्शन का मोस्ट कॉमन एज क्या है प्रेजेंटिंग हॉलमार्क क्या है whether it is causing bilious vomiting with abdominal distension bilious vomiting without abdominal distension or bleeding per rectum and so on secondly any named sign in that third what is the immediate investigation fourth what is the investigation of choice fifth what is the immediate treatment and sixth what is the treatment of choice many cases में वो सेम भी होगा कई बार वो डिफरेंट होगा so try to make a list like that intestinal obstruction newborn child older child or adolescent most common second most common third most common in each category how does it present which age does it happen any syndrome associated with it or not what is the classic one line mein presentation what is the named sign for that what is the investigation of choice and first in line investigation or the first investigation to do what is the immediate emergency management what is the definite management 10 points for each category एक दिन लगेगा but you revise it multiple number of times it will be very useful for your exam so these are some of the tips for revision I had specially prepared looking at the past papers and which I have seen people do I take feedbacks from students I also keep learning just like you so I hope you benefit from it Arpit, now I'm going back to the live chat again. In the end, I'll talk about the topics to revise, topics to tick before you sit for the exam. So Arpit is asking, mitochondrial disorder, Zellweger. Yeah, Arpit, they are badly given in Nelson. Let me see if I can do something about it. Govind is asking, sir, will type 2 Edison cause hypercalcemia like type 1? My mind is too clustered right now to make sense of the Edison में type 1 or type 2 में क्या हो रहा है. Let me answer it afterwards. Frankly, is as of now, I do not know. I will have to, make my charts of all that hormones and then come to the conclusion. So, please like and subscribe. I keep saying. Go then. Shweta is asking, can you explain the latest exam pattern? I have not understood, sir. Shweta and other students who have not understood. 150 questions, 150 minutes available to you. General pediatrics will be a part, but other pediatric specialties will also be a part. Difficulty level, according to NBE, will be the exit level. When you sit in a university exam or exit level, you know that there are questions asked from general pediatrics, systemic pediatrics, syndromes. There are questions asked from genetics. There are questions asked from community health programs, asked from vaccines, and asked even from your, drugs part. So you need to be ready with these particular aspects according to the exam. Having said that, having a look at the last three NEET SS papers, the topics asked from them is going to be beneficial. And some list I will be sharing today in the next 5 minutes also. Dr. Bismillah Bilal Mansoor is asking, good evening, sir. Please tell about time management during exam. Bismillah, I would strongly advise what you do is on the 7th to 11th, jo grand test is being held, the mock test which is being held, give that test. After the test is done and you get your score, I will be coming live again and I will be talking about the difficulties you face during the exam and suggestions related to your time management, right? You will also have given the exam and you would find your deficiencies, your time management issues, and all. At that particular time, that live session is something I have already planned with the team. So I've said it beforehand. The exact date will be announced later. And lastly, second last thing to announce. Second last thing is all those people who sit in the mock exam and they are in the top 10 of the mock exam, they will be getting 1 month free access to Prepladder Super Speciality Pediatric Pack. This has just been conveyed to me. So, पहले वाले में भी और बाद वाले में भी, all those who are in the top 10 of that pediatric part, right? Uh, Arpit is asking names of recent programs. If you can tell, we can read. Yes, Arpit, I'm coming to that. So, in the end, let us come to the end of the session. Now I'm going to talk about a list here. This list does not mean कि इस list से surely question आएंगे. You may not find a single question from this list. But what this list is, if I am in your place, 1 week or at least 2 weeks before the exam, I will make sure कि इनमें से कोई topic छूटा नहीं है. I have at least read the bare 8 to 10 points about each topic because these are the topics which have been frequently asked in the last 3 or 4 super specialty papers. I know not many of you have access to last few years super specialty papers. So based upon that, I have made a list which all of these things have been asked at least twice or more than twice in the last few exams. So you should be in the last 2 or 3 weeks, the topics you should be focusing on and at least reading. If I'm not, the word focus is not right, but you should at least go through them once, are pediatric epilepsies, renal tubular acidosis and related disorders, inherited tubular disorders, especially details of Bartter and Gittelman syndrome. Then nephrotic syndrome, the ISPN 2021 guidelines. Then you have, as I already told you, differential diagnosis of intestinal obstruction across various ages. Then we have emergency management of congenital diaphragmatic hernia and tracheoesophageal fistula. Then you have syndromes and their associated most common congenital heart disease. NEET SS 2018, 19, 20, 21. Every exam had at least one question where they asked this particular syndrome, what is the most common congenital heart disease? और इतना आसान नहीं होगा कि they will ask you Down syndrome में बताओ. वो सबको पता होगा endocardial cushion defect is the answer. Still, if it is asked, no harm in that. But the point is, even the relatively rare syndromes, there is a extensive list given in Park. There is extensive list given in Nelson. I have also discussed in my videos. Go through that list and be sure about this list. Then congenital infections are very frequently asked. Obstructive uropathies, particularly UPG obstruction and posterior urethral valve. These two topics are important. DD of antenatal hydronephrosis. I've already made a video on that. So DD of antenatal hydronephrosis, it is there on YouTube. You can go through it once. Then congenital hypertrophic pyloric stenosis, very frequently asked. Spinal muscular atrophy is a frequently asked topic. Then you have solid tumors like neuroblastoma, Wilms tumor, everything is important. Then PALS guidelines you have to read. Tumor lysis syndrome, NRP 8th edition, the new protocol. Minor changes compared to 7th, but all those changes you need to remember. Then Wilson's disease, management of neonatal jaundice, neonatal cholestasis. Then you have acute liver failure or fulminant liver failure. Then inherited hyperbilirubinemia, Dubin-Johnson, Rotor, how to distinguish between them. Then autoimmune hemolytic anemia, autoimmune hepatitis, then celiac disease, especially diagnostic part and HLA association, syndromes associated with celiac disease. Then AOCN guidelines, the 2021 guidelines on febrile seizure, West syndrome, neurocysticercosis, and global developmental delay. These four have to be done. Then I've already told that glycogen storage disease is very frequently asked. You have to go through it. Common primary immunodeficiency disorders, Wiskott-Aldrich, selective IgA deficiency, SCID, Dye-George syndrome, Shediac-Higashi, chronic granulomatous disease, gene, chromosome, basic defect, most common type of infection, any named sign. The same rule will be applicable. किसमें antibiotic देना है, किसमें stem cell transplant करना है. This you have to remember. Then IAP tuberculosis guidelines, common syndromes, and coming to DD of viral rash in children, there will always be one or two questions. बच्चे में रैश हुआ, डे 3 पे आया, डे 4 पे आया, डे 7 पे आया, डे 10 पे आया. This happened, started from trunk, spread to the outside, or started from face and then came on trunk. Itchy versus non-itchy, all that differentiation you need to remember. किस में नागायाम spot, किस में Forsheimer spots, you need to remember that. And then you have the uh, IMCI guidelines, very important. IMCI pneumonia diagnosis is very important. Diarrhea management. Diarrhea का दो तरह का classification है dehydration का. Mild, moderate, severe, which is the one which is favored in Western countries and corporate hospitals. And then you have the no, some severe. दोनों का separate classification you need to remember. And common fluids useful in common condition. First 48 hour of life, sodium free fluid. 48 hour onwards, isolate P and similar fluids. Uh, CHPS कौन सा फ्लूइड, रेसोमाल नहीं अवेलेबल है, कैसे बनाएंगे. देन सैम चाइल्ड, what is the ideal fluid presenting with shock, so it will be N by 2 in 5% dextrose. So similar conditions. Diarrhea, severe vomiting, the type of fluid that you will be using in various conditions, that is extremely important and very frequently asked in your exam. And then other than IMCI, the latest Indian data related to maternal mortality rate, neonatal mortality rate, infant mortality rate, child mortality rate, Millennium Development Goals you have to go through. मिशन इंद्रधनुष इंटेंसिफाइड, क्या क्या वैक्सीन है, पुराने से कैसे डिफरेंट है, एंड व्हाट आर द ऑप्शनल वैक्सीन बीइंग इंट्रोड्यूस्ड इन इंडिया. You need to focus upon that. And the major recently which have been there in the news, all these Bal Kishore program and Janani Suraksha Yojana, etc. Keep bare minimum points about it. Not the fine details. When was it started? What is the focus? और उसमें काम का चीज 2 या 3 लाइन में है, बस. Not the fine details are, they are not needed. Uh, Tired of speaking continuously. Any more things from your end? I've already told you what the important things. Like these are the things I will surely go through before I sit in the exam. Approach to microcytic hypochromic anemia along with your thalassemia and sickle cell anemia. Sickle cell anemia is 10 times more important than thalassemia. दैट डज नॉट मीन कि उससे क्वेश्चन श्योर आएगा, हो सकता है थैलेसीमिया से दो आ जाए, सिकल सेल से ना आए इस बार. बट इन केस इन टर्म्स ऑफ इंपॉर्टेंस, if you see, thalassemia has been asked only once in the last three papers. Sickle cell anemia has been asked 5 times in the last three papers. एक पेपर में दो दो बार आया है. सो सिकल सेल प्लीज फोकस ऑन अ बिट मोर, बट थैलेसीमिया भी पढ़कर जाना है. And the topics I will be taking up in a recorded or live session. Quick revision: red flag signs of milestones, GINA 22 guidelines, THAL, some points related to that, monoclonal antibodies, and individual vaccine details that you need to remember. These I will be putting as recorded or small short sessions. And after your 7th August exam is over, I will be coming live again. We'll be discussing more strategies. I'll be taking more doubts from your end, and I'll try to answer the maximum, most common, least common I can remember. Others which I do not remember, I'll tell कि भाई मुझे बाद में टेलीग्राम पे भेज देना. I'll try to answer with full confidence, with full reference. Vasant Kumar, I am talking 99% in English. 1% things which are said in Hindi is only a repetition. So if you can't understand anything which I said in Hindi, it is absolutely fine. All of the things have been told in English itself. The Hindi thing is only a repetition of what I have already said. If you understand both, you will be able to understand that I am only repeating some of the things in Hindi. Macrophage activation syndrome. BTS era, how much physics we should do? Zero physics. If we had to do physics, we would not be doctors. We'll be working in science and technology. So don't worry, Vasant. I make it a point not to discuss anything. I do understand that certain students they have some trouble in understanding Hindi. So whenever I discuss anything important, anything academic, it is always English. I have attuned myself over the years, so you can be rest assured about it, right? And yes, Arpit, MISC versus Kawasaki macrophage activation syndrome. Yeah, macrophage activation syndrome I've already recorded. Let me just see. I had recorded that video and I've also recorded HLHS also. Let me see if it is not available. I'll make sure that it is found out and it is put up. I do remember I have recorded this already. Any more doubts? I hope you have liked and subscribed to the channel also. And I've tried to answer most of your queries. Okay, it's time for us to take a break. I know you are also tired. Start revising. In the end, I'll summarize. Revise well. Do not leave any system untouched. In every system, number of revisions you do is more important. In commonly asked topics like Downs, Edward, Patau, Turner, Kleinfelter, Noonan, mm, congenital hypertrophic pyloric stenosis, give them extensive reading. 70% time for theory, 30% time for MCQs. If you can't find past papers, identify the topics asked and do those topics individually. And each topic needs to be done at least for 10 to 15 minutes. Each topic needs to be done, which has been asked in the last 3 years of your super specialty exam. Be prepared for any aberration in the exam because new pattern exam is going to be held for the first time. If something atypical comes, understand that it will be atypical for everyone. 99% students will panic. We have a general human tendency to panic when we see something new. Be mentally prepared for it. 99% people are panicking. Let them panic. I will focus and do whatever best I can do. If you do whatever best you can do, you will get through with a good rank. It's as simple as that. And be consistent, right? Arpit Sohane, all my earned stars to you. I hope, Arpit, you are giving these stars to me only. Thank you, thank you. Farhadiba, you're most welcome. Jyoti, most common CHD in Dijor syndrome. Now, this is again controversial. There are two erratas I want to emphasize. Wo I think different spaces I have told different things. Most common congenital heart disease in Dijor syndrome is interrupted aortic arch syndrome, followed by truncus arteriosus, followed by tetralogy of Fallot. In one of the old MCQs, interrupted aortic arch was not in the option, so truncus arteriosus became the answer. So I repeat, most common congenital heart disease in Dijot syndrome is interrupted aortic arch, followed by truncus arteriosus, followed by tetralogy of Fallot. The second point I want to emphasize is that in autoimmune hepatitis type 2, the most common antibody, again it is mentioned differently at different things. If you look at the video, the table which I have shown later, the table part is correct and not the initial part where I have written with hand. The table part is the correct part. This is errata I have already posted at multiple sources in the video. When you watch it, please correct it there, right? So it was lovely interacting you all. Thank you so much for being a patient listener to me, and it is always fun interacting with you all. So, any incorrect information from my end, anybody got, uh, you know, overwhelmed, or anybody got some incorrect thing from my end, that was not the intention. But the point is, any doubts if you have, you're most welcome to ask about it. In the next session, next week, which I'll be coming, I'll come live again. We'll talk more about it. So, I hope the session benefits to you. Thank you very much. Thank you so much. Karthi Muthun Sangaiya, sir, critical care paper, important topics and poisoning from where to read. Critical care, Dr. Karthi, I had already told in the previous session. You can have a look at the previous session as well, but I'll just summarize again. AIMS PICU protocol plus pulse guidelines. More than enough. More than enough. For poisonings, for a quick summary, either OP Ghai or Piyush Gupta as the Indian textbook base. Along with that, there is a chapter given in Nelson where it talks about the individual poisonings, food-based poisonings like mushroom poisoning and various types of shellfish poisoning. That particular part from Nelson, if time permits, you can do. Paracetamol poisoning, acetaminophen poisoning in details has to be done, whatever source you can find from. Other poisonings, they are optional. Uh, Snake envenomation, scorpion envenomation, only from AIMS protocol, not from any other source. Image-based questions, Dr. Bhushan, image-based questions are limited. How many they will be asked in this exam? Absolutely no idea. You may find no question, you may find 40 questions. It will be, a surprise for everyone. Usually, the questions, if you look at the last 2 or 3 papers, usually the questions which are asked, they are from congenital heart disease or syndrome based things. So, these are the two areas: common X ray findings and image based things of the common syndromic associations. That are the things that you should focus on for image based questions. Do not go too much into image based preparation. Thank you so much. I think I've answered most of the queries. Thank you so much, and we meet again next week. For any further academic doubts, or if some doubt is left, you can post again, and or you can ask on my Telegram channel also. I'll try to address all of them again. We meet next week. Keep preparing, and the videos which I promised, they are being recorded. After this session, I'm going to take a cup of coffee, and I'll start recording again. So they will be available shortly. Thank you so much. Bye bye.